Good afternoon. My name is Jeannie Ong, and I am the Director of Community Health for Advocate Aurora Health's Northern Illinois region. And today, we thank you for joining us for the consequences of underage drinking. It's a panel presentation today, and we have three panelists. And I'm also joined today by my colleague, Keely Gallagher, Community Health Coordinator at Advocate Good Shepherd Hospital. The presentation today is focusing on underage drinking, and this is under the heading of substance abuse prevention. And substance abuse is actually selected as one of our priority areas for the Northern Illinois region for Advocate Aurora Health hospital systems. Substance use was actually identified as one of our health priority areas of concern in our recent community health needs assessment. We identify programming and implement those in the community to address substance use, and those are done in collaboration and partnership with many community partners, some of which you're going to hear from today. We have three panelists who will each cover related topics in their individual presentations, and each will introduce themselves at the beginning of their section. So at this point, I'm going to turn it over to our first presenter, Jim Scarpace.
Thank you. Yeah, so I want to talk today a little bit about the impact of underage drinking on brain development. And I think this is an important topic to look at because, especially when we talk about alcohol use disorder, teens tend to be exposed to that in so many different ways because it is an acceptable substance on some levels, not only in the state of Illinois, but across the United States. First slide, please. So let's talk a little bit about this first. And I think what would be helpful to review is, why do teens use substances? And there's a lot of different reasons that can contribute to the use of substances. And as we go through this on the slide, I think this will make a little bit more sense. First and foremost, one of the things we need to know about substance use disorder is there's a strong genetic predisposition to this disorder. It's a disease of the brain. We've known that since the 1950s, believe it or not. The American Medical Association told us substance use disorder is a disease of the brain. And that came from decades of study that preceded it, that went back to the 1920s. And specifically around alcohol use disorder and alcohol use, we know that has the strongest genetic predisposition of any of the substances that individuals may struggle with. So if I am a young person who may or may not know, I have a family history of either my parents or grandparents that may have struggled with alcohol use disorder, the chance of my developing an alcohol use disorder can be as high as 50%, usually ranges between 25 to 50%, depending on family history of alcohol use disorder and how many relatives or close relatives, usually parents and grandparents, have struggled with the disorder. And my exposure to the substance, i.e. drinking, is what triggers that genetic predisposition. So sometimes it happens as a result of things that are beyond the individual's ability to control. The other piece of this is teens use substances to manage emotions, self-medicate, especially if you're struggling today. And in the world of social media and peer pressures, there is struggles that us as adults probably never experienced as a teenager, that teenagers are experiencing now. Constant scrutiny that can contribute to depressive symptoms, depressive disorders, anxiety symptoms, anxiety disorders. And so sometimes teens will turn to alcohol as a way to self-medicate or manage those emotions because they can become overwhelming. And as I said, to escape some of those social pressures and peer pressures that are more intense than ever in the current generation and what they're experiencing. One of the other important pieces in terms of substance use disorder, and especially when we talk about alcohol use disorder, is brain development. And what's important to know is that the adult brain doesn't fully form until between the ages of 25 and 26 years old. And the last two components that form are two parts of the brain. One is called the nucleus accumbens. And the nucleus accumbens really manages and connects to the limbic system, or the pleasure or reward center of the brain. And that part of the brain is indicated and influential in both substance use disorder and mental health disorders, the limbic system. And so that pleasure and reward system gets overactivated if you're using alcohol or other substances. And as a teenager, because that part of your brain isn't fully developed, it can really cause delays in development in that area and cause it to become out of whack, if you will, or not firing the way it should as you develop into an adult, because the alcohol and other substances are impacting that part of the brain. Now, does that happen to everyone? Of course, it doesn't happen to everyone. It's really about exposure, age of use, how much you're using, over how many days, to volume. All of those things contribute to these parts of the brains being overactivated, or this part of the brain being overactivated. So it's something that, you know, can impact not only the teenage years as a teen's using, but their young adult and older adult years if the brain is impacted negatively by the alcohol use. The other part of the brain that's impacted, that's not fully developed till 25 or 26, is called the prefrontal cortex. And that really is responsible for executive functionings, impulse control, as an example, being able to weigh good and bad, anticipating how actions might affect consequences or future consequences. It affects decision making, moderating behavior. And again, extensive alcohol use under age 25 and 26 can delay the development or stall the development at times of the prefrontal cortex. And so from a brain perspective, even though alcohol is a widely accepted substance, and one of the main reasons it is still illegal and will continue to be illegal for individuals under age 21 is because the younger that you engage in alcohol use, the more risk associated with the underdevelopment of those two parts of the brain. Next slide, please. That being said, alcohol use is very much a part of the teen experience still, unfortunately. It's the most commonly used drug among youth in the United States, and alcohol is a drug, and one of the most dangerous drugs, unfortunately. And again, you know, when we talk about genetics, we know about anywhere between 1 in 10 and 1 in 5 teens and adults could have some form of alcohol use disorder, either based on genetics or exposure. And alcohol being a substance that really impacts the body and the brain, both psychologically and physiologically, you know, can cause damage to organs and extensive use. It's one of the only substances that you could actually have risk of heart attack or stroke or seizure from stopping use of if you're drinking in large quantities over large periods of time, which is why detox is required. And unfortunately, what we see with teens is excessive drinking or binge drinking can be very common. I had one teen that I worked with that said they didn't even like the taste of alcohol, but they just drank to get drunk because that's what everybody does. I think perceptions become distorted in teenage years, especially because those two parts of the brain have not fully developed yet, which helps those two parts of the brain that I talked about earlier really help in making decisions around, you know, good and bad and what's going to be beneficial and what might be detrimental. And so, you know, extensive alcohol use on top of that, you know, puts them at higher risk. We know that more than 90% of the alcohol by teens is consumed in the form of binge drinking. And really binge drinking is taking in more drinks than your liver and brain can process, causing a euphoria or a high of sorts from drinking, which, you know, causes the brain's blood alcohol level and the body's blood alcohol level to not be able to process alcohol appropriately, which is getting drunk or getting intoxicated. And what we know about this, next slide, please, is that not only in addition to the amount of drinking or age of first use being so detrimental or risky in terms of teen brain development, but it puts them at risk of, you know, substantially other issues, drinking and driving being a big one, putting them at risk of not only harming themselves, but harming others. You know, the age of onset of use, if you look at the slides here, In 2016, the National Survey on Drug Use and Health reported that 19% of youth aged 12 to 20 drink alcohol, and 12% reported binge drinking in the past 30 days. In 2017, 8% of 8th graders and 33% of 12th graders drank during the past 30 days. Age of first use is important. I think that what we know about alcohol use, especially for teens who are at risk for alcohol use disorder, is that the more they drink and at an earlier age, the higher risk they are for developing a severe alcohol use disorder. I've seen many adults come into treatment at Gateway who talk about their first use being around age 12 or age 13. And, really from there, it getting progressively worse. Next slide, please. Because it's a progressive illness, the implications are not only medical, but they're social, relational. As you can see here, not only do we see school problems and social problems and legal problems, as I talked about earlier, but the physical problems can be substantial. Because of that genetic predisposition, the risk of kidney and liver disease are higher based on age of first use, because again, the organs are still developing. They're still, as a youth, drinking large quantities of alcohol, their ability to manage that substance without damage to those organs is not as resilient. I had a 24-year-old here that was already on a liver transplant list who started drinking at age 15. And at age 24, her liver was already failing from extensive alcohol use. It's just really important to understand the implications that not only alcohol can have socially on a teen's development and struggles, but both physiologically and most importantly, cognitively, because as I said earlier, that brain development can really be stalled or impacted by extensive use. Thank you.
Thank you. My name is Detective Heather Koniak, and I work for the Wakanda Police Department. I am also currently assigned to Wakanda High School as a school resource officer. And today I am going to be talking about social hosting. Next slide. Today we want to discuss what it is and what are the consequences. Next. First, I think it's important that we discuss what is social access. And social access is when youth are able to obtain various types of alcohol from their parents, a friend, or a sibling. And sometimes from the parents, it can be with or without their permission. And we'll discuss that a little bit further as we move along here. Next. I think it's important to note that based on the Illinois Youth Survey, the 2020 Lake County report shows that 73% of 12th grade students that have admitted that they use alcohol obtained the alcohol from a social source. And this can include friends, parties, siblings, and this stat was anything other than their own parents. Next. So that number is very alarming, I think. And so we have what's called social host liability laws in place to prevent some of those things. And so we're going to talk about what are social host liability laws. In Illinois, social host laws basically hold the parents accountable or other adults accountable for knowingly permitting this to happen. And so they're basically saying it's okay for youth to consume alcoholic beverages at their residence or on any other property that they might be in control of. Property that the individual controls can be their home. It might be a piece of property that is vacant, but they own that property. The kids might go there for parties, etc. It can be hotel, motel room that someone rents. It can be limousines, party buses, boats, condos, other rental units, campers, anything that they have control over. Next. And so these laws are important, and we're going to run through some of the reasons why. So it's basically, it gives us a practical tool for holding these people accountable. And without being able to hold someone accountable for something, it's really hard to enforce something. It also, because we have these social host laws, they will empower concerned citizens, neighbors, maybe even people that are at the party. It will empower them to report this underage drinking. It also provides us as law enforcement officers with a tool to address this underage drinking. Because we, as we've heard from Jim, and we will continue to hear throughout this presentation, it's not only a threat to an individual, but it's really a threat to community health. It also provides cost recovery fines, and those can be used for law enforcement efforts, as well as efforts by various coalitions. And I know we're going to hear a little bit more about that from the next presenter. And it also decreases social access. And we talked about what social access is. So by having these laws in place and people knowing that they're going to be held accountable potentially, it will reduce that social access and hopefully reduce the underage drinking. And it sends the message that underage drinking is not acceptable. Next. So what are the consequences? In Illinois, we saw the social host law go into effect January 1 of 2013. And the statute is listed there. There's basically a couple different sections that apply. And the important thing to note here is the fine. If you look, you can see that the fines range anywhere from $500 up to $25,000. And that is because of the difference in classification. So if you look at potential jail time, you're talking about 1 day up to 3 years. And it could be a Class A misdemeanor or a Class 4 felony if the violation happens to result in death or great bodily harm. And so the difference in that is a misdemeanor would have obviously a lower potential jail time, lower fines associated with it. But you can see when you move up to that Class 4 felony, those fines can get substantially higher. And then there's also other things put in place by the court system, and it could be probation, it could be court supervision, where basically the court's going to be keeping an eye on a person for a predetermined amount of time to make sure that they don't have further or future violations. There's also some legislation that talks about subsequent violations of these laws. And so those consequences can get worse, as it might be your first offense, second offense, third offense. They'll progressively get worse. There is something called a safe harbor provision. And that is if the person basically reports. So if the person that occupies the residence or owns the residence where the underage drinking is happening, that person can request police assistance in removing underage drinkers, but that has to be done before any other formal complaint happens. So someone can't say, well, I called because they know that the neighbor already called. But it is a safe harbor provision that will allow the person to make a report. So if they're not accepting of it, if there's a party at the house and they want, those individuals removed, they can request assistance and they will avoid prosecution for that violation. So this is based on the state statute. Next slide, please. There's also what are called local ordinances. So we have social host ordinances. And it's another basically opportunity to charge someone or hold someone accountable for violating these laws. And so you have the state statute that we talked about, but then we also have these local ordinances. So the important thing to know in your community is there local policy? Does it already exist? And if the answer is yes, then we really need to be working on publicizing and informing the community about those laws. If not, then it's important to make sure that you can build relationships with the stakeholders in your community to be able to do that. And we've listed out some of those stakeholders. In Wakanda, we have a social host ordinance. The fines for a first offense start at $500 up to $750 per offense. That's for the first offense. Each subsequent offense would be $750. And so that's for our local ordinance. If we had an individual that it was maybe their first offense, we might start with the local ordinance, but it gives us the ability to choose between some options, whether we're going to charge someone with a local ordinance or we're going to charge them with a state violation. And, you know, it's important that communities know if those laws exist. Next slide, please. So this is kind of a campaign that has gone around, and it's basically those who host lose the most. And so it's important to send a message that underage drinking is not going to be tolerated, and that it's against the law. And it's important to send that message to the youth that you come across. Next slide, please. So thank you very much. This is my contact information should anyone have any further questions.
Hi, I'm Laura Crane. I'm with the McHenry County Substance Abuse Coalition. I have been doing prevention education and coalition work for about 15 years now. And today I'm going to talk with you a little bit about the new Illinois law that allows home delivery. Next slide. Go ahead. So home delivery for Illinois started during COVID. At the time, Governor Pritzker and the legislators felt that it was important to support businesses that were struggling economically by offering opportunities to not just have food delivery, but alcohol delivery in order to hopefully maintain and keep doors open. But what happened during that time was increases, excuse me, not just in Illinois, but nationwide as these types of things occurred. And so these are some stats that we saw, 262% increase in online sales of alcohol nationwide during the pandemic, an increase in overall frequency of alcohol consumption for adults 30 to 59 years old. Specifically for women, there was an increase of 41%. And that was primarily in wine. When we looked at alcohol sales, there was a huge increase in wine sales and spirit sales by retailers. And then there was also increased sale via Drizzly. Drizzly is a home delivery service that allows alcohol to be delivered at home. In Illinois, it allowed restaurants to actually have their own restaurant staff delivered to homes. It also increased options like curbside pickup and cocktails to go. And we'll talk a little bit more about what those differences are. Next slide. Go ahead and yeah, thanks. So past 30-day consumption, I know we talked about this with the kids, but it was also really important when I looked at it in COVID. And so these are just some numbers to look at when we looked at the National Survey on Drug Use and Health from 2019 to a study that was done in 2020. When we see an average day of drinking in a 30-day period in 2020 at 12.2 versus 4.8 for adults, that's a significant number of days of drinking. And you can see all the numbers kind of align with that we saw this increase, not just in the number of drinks being, or number of days being drank, but also the binge drinking went up, the extreme binge drinking went up for adults. And we need to remember youth were sitting in homes with parents because most of them weren't in school watching this kind of drinking occur. We have talked with a lot of school staff who now have kids who are hybriding back, who are talking about they drank with their parents during that time. So that has been a significant conversation that we're starting to have now that kids are back and sharing with us. And so we're very concerned about what that looks like. Go ahead. I'm not going to read this whole thing, but it is House Bill 54. If anybody wants to go look it up. It did pass in the legislation or in the legislators' offices in January of this year. It is sitting on Pritzker's desk. to be signed. It went back and forth. There were some amendments being made. I did talk with the Liquor Commission just this morning to find out what the status was. It went back for some additional changes, not to reduce it, but actually to increase it. There were some, in the way the bill was written, there were some limitations that actually eliminated things like craft breweries and things like that could not be a part of this. So they're actually opening the doors more so that things like craft breweries would be able to take advantage of being able to have their alcohol served directly to homes as well. And so we need to be aware that this will include restaurants, it will include breweries, it will include wineries, and it will include restaurants to be able to serve alcohol from their restaurants without or with food orders. So go ahead. So there's 4 different categories when it comes to home delivery or the ability for people to pick up at restaurants. The first is direct home delivery. A restaurant, a bar, or retailer can use their own employees or a third-party service like Drizzly to deliver alcohol to a consumer's home. States that have had this already have already seen serious problems with it. It's one of the #1 concerns we've had. Conducted compliance checks to ensure youth were not accessing alcohol in California showed a 25% failure rate in restaurants and an 80% failure rate in home delivery. That doesn't really bode well for us unless we can get a grip on this in Illinois. I shared this story because we delivered some alcohol to our home from a restaurant during COVID. My daughter, who's 23 years old, but is often misidentified as a high school student, answered the door, accepted the alcohol, was never carded, received 8 alcoholic drinks with no questions asked. I think that's not a real positive sign for what potentially leads into our future. And so home delivery for me is a large concern when we think about youth. Talking to the Liquor Commission, there is supposed to be barriers to that. Alcohol cannot be paid for at the door. It has to be prepaid. It is supposed to be delivered by someone who is 21 who works for the restaurant. It is supposed to be carded. You are not able to leave a note saying I'm in the bathtub or I'm out in the back or I'm not available to pick up right now. But reading the California information, those are the type of failures that they saw when these compliance checks did not work. Next slide. Curbside delivery, the difference between this is when you order the same type of thing from a restaurant, but you pick up at the location. You pull up and they bring it out to you. Again, you are supposed to pre-purchase. You're not supposed to be able to pay for this at the curbside, even though at a restaurant you might normally be able to pay cash or whatever at that. You're not supposed to be able to do it. For alcohol, you are supposed to be able to card at the window. Carding should be done again by someone who is over the age of 21. At a restaurant, you might be able to be served alcohol and carded by someone 18 inside, but curbside is supposed to be done by someone who is 21 or older. Again, this can be done with or without a food purchase. If it is a distilled product, it should be served in a bottle with a thing. So for example, if you ordered a margarita, the premix would be done in a container, but the tequila should come in a little mini bottle with a seal on it to give you an idea of how that might happen. Next one. Cocktails to go. This is a container that must be filled, sealed, and secured in a certain type of bottle that's been designed and identified by the state. Again, I'll tell you, I happen to have ordered a cocktail. That was what was delivered to our home, and it came in a styrofoam cup with a lid on it. It would not have qualified in cocktail to go category. So again, when we look at failure, compliance failure, it would not have been any of these things. And so as we as a coalition start to look at this and how we're going to address this in our community, I think these are the types of things that we need to be assured of, that these standards are being met as we continue this law. These are not supposed to be delivered by a third party. However, that is part of the law that they are revising as we speak, so that Drizzly and these types of companies can indeed still serve those. I went on today and Drizzly is advertising that they can sell these things. I asked the Liquor Commission about it. They're aware of that advertisement, and they are working to get that removed. But Drizzly currently is advertising they can deliver all of this stuff. Next one. And then direct delivery is, this is you go online and to your favorite liquor store and you place your order and the whole package is shipped to your home. A little different than, say, if you're a wine club member and you have a monthly package sent to you, but very similar. It sounds like UPS and the United States Postal Service have both gotten out of alcohol delivery because of the requirements. So it sounds like possibly FedEx is the only one who is now doing direct delivery from an online purchase. They do have to, again, be shipped to someone who is then receiving it, showing identification, can't be left at your door. All of those things need to be taking place. And so right now, I couldn't find anything on compliance with direct delivery, and the Illinois Liquor Commission wasn't aware of anything that would tell me the success rate of direct delivery. Most of that had at this time been primarily things like wine clubs or that kind of direct delivery. Next one. So what do we do with this? So as a community, as a coalition, some of the things we can do is work on what is a better alcohol compliance check now that we're in this new format, and start working with law enforcement now to redefine and determine how we could do these types of checks. I know we spoke briefly with Advocate and how can we promote Bassett training. Bassett training is the training that servers get right now and bartenders get to to know what a appropriate ID looks like, what are valid IDs, what are illegal IDs, but it also is determining, should I be serving this person? Is it appropriate? So for example, I especially think of this in curbside. We shouldn't be handing over alcohol to someone who's behind the wheel, who we may be questioning. So I think especially in those categories, Bassett would be particularly important. Illegal ID checks, especially as we talk about youth promotion at that point. You know, I don't want a 18-year-old pulling up and picking up, you know, their alcohol. Ordinance implementation, so we can ask that local ordinance change so that it qualifies Uber drivers or Drizzly drivers and that type of thing, which has never been in an ordinance, to be required to take Bassett training. And we can also look at alcohol outlet density. This would include things like alcohol retail sales, as well as restaurants and other locations that have open alcohol sale, and minimizing how many of those are in a certain area. The less alcohol sold in retail, the less likely there is access for youth. And then awareness campaigns. You know, for a parent especially, I don't know how many parents are thinking about the fact that their child could call and have something like this delivered to their home. They might be used to watching for parties or watching for when they go to a neighbor's house, but if they go out for dinner one night, they may not be aware that their child could just call and potentially have something delivered to their home with not too many barriers to that system. Next. This is my information. I'm more than willing to follow up with anybody who would have questions. And thank you for the time.
Hi, my name is Keely Gallagher, and I am the Community Health Coordinator at Advocate Good Shepherd Hospital. Next slide. So of course, Advocate Aurora cannot tackle underage drinking alone, and we are very lucky to sit on multiple coalitions in our communities and work with a lot of partners on substance abuse. We listed just a couple of our community partners that each of our hospitals work with, and that is Good Shepherd, Condell, and Sherman Hospitals. Those partners are Be Strong Together, CSHE, which is the Coalition for a Safe and Healthy Elgin, the Wakanda United Partner Substance Abuse Prevention Coalition, and then Libertyville Connect. And we did list all of the contacts here with their email addresses, so feel free to reach out with any questions or resources. One of Kyle Kick did ask a question to our panelists, if any of you would like to answer, and that was, many parents drank alcohol when they were in high school or even middle school, and feel that this is just a part of growing up. They hear this often from parents. So she asks, what would you like to say to a parent who is thinking about providing alcohol to their own child or to other children?
So this is a question I get almost every presentation I do. And I think that this presentation answers a lot of that. And I think the first thing I say to a parent is, we've learned a lot since when we were kids. I was that kid who drank in high school and had my own children and had to make a decision that that wasn't right for me, because I learned the brain science that Jim talked about and everything that it impacts physically for them. And those were just details we didn't have, or that our parents maybe didn't know enough about when we made those decisions, those decisions were made, or when we weren't monitored as closely. And I think that, as I listen to Heather talk, the other thing is we need to remember our own potential impact as a parent if we choose to let those things happen under our own guidance. But really, for me, it comes down to the health of my own children and the children that I adore like my own children. And I don't want those impacts that could potentially happen for them.
Yeah, and I would just, echo what Laura said. And I think if, being in that situation, the advice I would give a parent is, have an honest conversation with your kids about why you can't do that, and not being afraid to say exactly what Laura said, which is, looking back, I made some decisions as an adolescent that, weren't the best decisions. And I regret some of those, and the risk to myself and to others was substantial. And I don't want that for you. And I want you to understand the risk associated with drinking. Yes, there's a chance you'll be fine drinking as an adult, but my job as a parent right now is to look out for you. And the risk associated with this substance is just too great to take that chance. That would be the conversation I would have.
I think the other key one for parents that I always forget to say is, it's not just whether you'll grow up to be an alcoholic. There's so many daily risks that, whether you get behind the wheel, whether you just fall and slip because you were, intoxicated and something happens, not even getting into things like violence that's associated with alcohol and that kind of thing. So I just think alcohol puts you at a larger risk overall as a teenager, especially.
Heather, do you have any comments to add for this question?
I would echo what they both already said. And of course, just reminding them that there are legal implications, and those are just the criminal legal implications. There's the civil side as well. So if something happened that did result in death or great bodily harm, parents would be looking at civil liability for sure, which could affect their house, losing their home, losing their financial security and things of that nature as well.
Thank you very much for those answers. I appreciate it.
Well, that was actually a perfect question to wrap us up, hearing from all of our panelists now. And I do want to thank each of you for joining us today. The panelists that you heard from today are a great representation of the key community partners that we as a healthcare system need as we're implementing community health initiatives to address substance use. And I would also note that our Northern Illinois primary service area for Sherman Hospital, Good Shepherd Hospital, and Condell Medical Center includes all three northern counties, so Kane County, McHenry County, and Lake counties. And the presenters today are representatives from each of those counties. And they are working hard with us each and every day. We've really reviewed this issue of underage drinking from a variety of perspectives, and we hope that you have found it informative. And the one ask that we have of you as you view this video is to please share it widely with others in your community, individuals in your family, or others that you feel really need to become more well-informed about these topics. Thank you very much for your time. Have a great day.
Thank you.